Many of us accept achy joints as a normal part of an active life. Prolonged aches and joint pain can often signal a more long-term health concern, including arthritis. We've invited Dr. Mercedes Quinones, a rheumatologist at Howard University Hospital, to help us understand joint health. Thank you for being with us, Dr. Quinones.
Thank you for having me.
Let's talk rheumatology, the science of rheumatology. What is it exactly?
So rheumatology is a specialty of medicine where we focus on joint diseases. And a lot of people, my patients, think it's just arthritis, rheumatoid, but we also treat all of the autoimmunologic diseases, such as lupus being one of them, and rheumatoid arthritis as well.
Okay, so from my understanding, rheumatologists like yourself sort of act as detectives for other doctors. You know, another doctor may have a patient she's complaining of an ache or some swelling, and those are the things that you find interesting, and those are the things that you can then help diagnose.
Yes, correct. A lot of times when there's quote-unquote puzzle cases where other doctors want us to put everything together in a multi-system process, they tend to refer to rheumatology. And I think our job is to make sure that there isn't a larger process going on. If, for example, a young person is complaining of a lot of joint pain and stiffness, we want to make sure that it is not something like rheumatoid or lupus, and just call it plain quote-unquote osteoarthritis.
So in general, those aches and pains that fall under the ambit of rheumatology, do you have to be a certain age before this kicks in, or it can happen at any point in your life?
It can happen at any point in your life. I'm actually a pediatrician as well, so I have treated children with juvenile idiopathic arthritis, so even at the age of 2 to 3 years old, you can start having a juvenile form of what is adult rheumatoid arthritis.
And how does that present itself in children?
In children, it's different because it usually presents as one joint, so usually the most common is the knee, but frequently children do not complain of pain, which is unlike adults. So they'll be running around, they'll be limping, but they'll still be running across the playground with one usually swollen hot joint that needs to be, you know, drained and everything. Whereas adults with rheumatoid do typically complain of a lot of pain and a lot of stiffness.
Complain, period.
Right. So it can happen, and even children and adolescents can get lupus as well. So these are diseases that can be present with somebody across their lifespan, not just adulthood.
Okay, let's talk specifically about lupus right now.
Okay.
Obviously, autoimmune disease characterized by acute and chronic inflammation. When we say autoimmune disease, what are we talking about?
Basically, that's just an umbrella term for when the body, for some reason, we haven't identified whether there's a genetic predisposition, an environmental trigger, forms antibodies or basically signals where our body starts attacking itself. And frequently it's in the connective tissues, for example, the joints, the muscles, but it can affect other organs. For example, in lupus, if the antibodies decide to attack the kidneys, there can be kidney involvement, the lining of the heart or the lungs, and even the brain.
So you just don't know what these antibodies will do.
Exactly. But it's somehow the body is turning against itself in a way, and we don't know exactly what the trigger is.
No, really? So just one day I wake up and I've got whatever, swollen, stiffness in my joints, on, and I come to you and you cannot say definitively, you know, it's because you're eating too much ice cream. It's not like, if only it were that simple, right?
It would make life simple, yes.
It would make life simple. Lupus, from my understanding, is also most common in African Americans, Japanese, and Chinese. Why?
It tends to be, I think there seems to be some genetic, again, predisposition. There's some studies going on about identifying what specific genes are present in certain patients. It's definitely more common in ethnic minorities like myself, the Hispanic population, African Americans. And why I think it's important to identify in these populations that we treat is that the disease can be more active, it can be more aggressive. Thus, it's very important to identify it early and make sure that the patient gets on the right treatment.
Yeah, that's very important. Speaking of, I have a friend who has rheumatoid arthritis. Now, it didn't kick in until she had to start dealing with an NBA player's wife who literally drove her insane.
Oh,
and that's it. That's stress.
Yes.
And all of a sudden, she has rheumatoid arthritis, a young girl, and swollen. She's on medications that are swelling her up. Talk to us about rheumatoid arthritis, because 1.3 million Americans are impacted by this.
Yes, that's correct.
That's a lot of people.
It's a lot of people. It's not as prevalent perhaps as osteoarthritis, but certainly about 1.5 million Americans is important. Is very important. So rheumatoid arthritis is inflammation that primarily affects the joints. So it usually doesn't affect the kidneys and the heart lining and all that, such as lupus, but it can be very devastating on the patient's life. It can cause a lot of pain and stiffness. It can really impact that person's activities of daily living. And as you mentioned with your friend, stress can definitely be a trigger, and that can go for lupus and other autoimmune diseases as well. That can go for
anything, can't it?
Right, right.
And the treatment I believe she's on is prednisone, which is, we know that that's a steroid that can really, and it's caused her to gain weight, and it's just, it's disheartening for her. She's a young woman, and she's trying also to have a child, which this is getting in the way.
Right, exactly. So prednisone we frequently use to treat not only rheumatoid, but lupus and other diseases as well.
And explain what the steroids, explain what it does.
So prednisone is there's many forms of steroids, but prednisone is the one that most rheumatologists use. It's a very potent anti-inflammatory, so it's more potent than, let's say, naproxen or one of the over-the-counter anti-inflammatories. And it works on the immune cells to decrease inflammation relatively quickly. The problem with prednisone, it has very long-term deleterious side effects, such as the weight gain, can be some mood alterations, osteoporosis, cataracts, etc. So we try to use it only in the short term, and for the long term, we need to put patients on disease-modifying agents, which is why it's important that patients come in early so that we can start those agents early and get the prednisone off relatively quickly because of those side effects.
Dr. Mercedes Quinones, rheumatologist for Howard University Hospital, thank you so much. If you have any joint pain, go see her. She knows what she's talking about.
Thank you very
much.
much.
Thank you.